Let's talk about poop, specifically newborn poop. The thing you now have more pictures on your phone than your wedding day, and you're asking ChatGPT about it like a forensic scientist. We're going to give it the time it needs today, so listen all the way through to the end so you don't have to text these pictures to your doctor. Wink, wink. Welcome to the Nutrition for the Early Years podcast with Dr. Liz, your guilt-free guidance for feeding your family. This podcast is for folks who are craving better nutrition for their kids, but are tired of the whiplash of nutrition claims and diet culture influence. You're reading labels, paying attention to ingredients, but you still doubt yourself, and for good reason. Food goes deep, and often we fear making costly mistakes that as parents we hope to prevent. If you're ready to explore the ins and outs of your child's actual nutrition needs and nourish the whole child from the inside out, hang with me, Dr. Liz Daniels. I'm a board-certified pediatrician plus registered dietitian, and we're going to dig deep into real-deal nutrition science, honest talk about barriers to health, and real stories that I help address. So let's dig in. All right. Howdy, guys. Welcome back to the Lunchbox Reformation with Dr. Liz. This week, we are talking about, as promised, poop. I can hear my boys in the background going, poop. I have 3 boys, and they love these kinds of conversations. But actually, today, we're talking about not just any poop. We're going to talk about poop in the beginning, like baby poop, okay? And how long can they go without pooping? Or how much is too much? And what color is the right color? And all of those things. And then we're going to talk about when they really seem to be acting as if they're dying when they poop. Okay. So I like this topic because it's one that I get all the time. Like even our most experienced, educated, thoughtful parents, it is like a question that I get all the time. Even doctors asking doctors questions. I have other surgeons that, aren't pediatricians that'll ask questions about these because it's confusing. And there's so much out there you have to interpret this by their poop. And okay, here's the bottom line. You should listen to the whole thing. But the bottom line is most of the time, it's still normal. Okay. What is considered normal poop is really broad. So we're going to talk today about infant poop, all of those things. If you have a newborn or if you are about to have a newborn, I want you to save this episode and just go ahead and hit subscribe if you haven't already, but save this episode because I guarantee you're going to have a question and you're going to think, should I text my doctor pictures of my baby's diaper? And the answer is most likely going to be no if you have this podcast. We get pictures in our portal through our patients all the time. And I really don't make many clinical decisions based on a diaper. I don't know many pediatricians that do. It's the history and it's the weight gain and the growth and the symptoms that you're experiencing that are going to lead me to help navigate one particular thing with your diet or your formula or your breast milk or whatever. It's often not going to be what's in the diaper. I know. It's a surprise, huh? But I like to tell my families, poop is really not a report card of how you're feeding your baby or attention that you need to be having in some different direction. It just is their digestion, it's their poop, it's their waste. And it changes because as they grow, what their body needs is going to shift as well. So in the beginning, day of life 1, bear in mind that the large intestine, as you've been growing this baby in your womb, really isn't they're not pooping. They shouldn't be. That's why we do emergency C-sections if we need to. But they really aren't pooping. They're collecting dead skin cells and tissue and, some components within the colon, but they don't ever poop until they're born. And so the first poop that's in there is just that old sticky black tarry called meconium. And in the first few days of life, that's going to transition over to seedy, usually pretty yellow, soft bowel movement. And that transition takes place because they're actually getting nutrition from the mom. If they're breastfed and they're only getting a little bit of colostrum in the beginning and there's a delay in mom's production of milk, there's going to be a delay in the bowel movements, most likely for the baby. What I mean is that day 1, we expect at least 1 bowel movement. Day 2, we expect at least 2 bowel movements. Day 3, we're typically going to see 3. And then sometimes there's a quiet waiting period. And I have a lot of families that get really worried. They'll come in for their newborn visit on day of life 4 or 5 and be like, we haven't had a bowel movement in over 24 hours. And we really wanted to call the emergency line, but we weren't sure. And it's okay. Now, the first question I'm going to ask isn't, when was their last poop? My first question that I'm going to ask is, how are they growing? And what are they eating? And how much are they eating? Because in the very beginning, most likely, if you're delivering in a hospital, they will not discharge you if you haven't produced a bowel movement. And this really matters because what we're looking for is the rare kid who has something called Hirschsprungs, where the nerves that help innervate the colon, like the large part, the distal part of the colon that connects to the rectum, doesn't have the wiring in it. So they don't have the stimulation, the neurologic stimulation to create a bowel movement. And it can be very dangerous and it can be very serious. But if they're producing a bowel movement, then you're in a pretty good place. There are some nuances here. So, for what it's worth, we still like to pay attention to that process and what's going on. But I think the take home here is that if you've passed meconium and you're in the transition period waiting for that new stool to come in, this is where the conversation is going to go. Your pediatrician is going to want to know how much they're eating, how often they're nursing. Is it comfortable at the breast? Are they gaining weight? In the days after you get discharged from the hospital, we expect that a baby is going to lose some weight. Typically, you're expecting to lose up to about 10% of their body weight in the first 5 days of life. They usually reach the lowest point at day of life 5, and then it slowly increases back up. And typically, they're regaining back up to their birth weight by 2 weeks. Now, there are some exceptions to that, but hopefully you've seen your pediatrician by day of life 5 already, and you are getting the attention you need and the support you need to navigate that. But moving past the first 2 weeks, what I often am noticing is that families will be concerned about green poop, normal. What about really dark poop? Normal. What about poop with every single time they sneeze or eat? Normal. What about a week without a bowel movement? Also normal. And that's frustrating for parents when you feel like you need some kind of indicator, a reminder that everything is okay. But remember that in the first month of life, they are maturing tremendously and their digestive tract is maturing tremendously. And so their stools are also going to reflect that. So what I like to share with families are sort of my guardrails for when I'm worried. Number 1, I'm worried about their poop if a baby is having trouble gaining weight adequately. I'm worried about a baby's poop if there's blood in it. Now, about the blood, typically when we see blood in the diaper, it's little flecks mixed in with the poop. I don't typically see big globs or clots of blood. That is more urgent, probably should require some attention. But sometimes we'll see blood mixed in with the regular soft poop. And that can be a sign of something called cow milk protein allergy. It's not an emergency room visit. For most babies, it's really just an office visit. We want to see what's going on. We want to see the baby. We want to talk through it with you. But it's not usually something that requires going to the emergency room. Now, that said, the first thing I'm going to do if there is blood in the diaper is look at the baby's bottom and make sure that there's no fissure or there's no tearing on the skin. And we kind of go from there. You can have hemorrhoids in babies and you can have fissures as well, which is where they're straining really hard and they kind of just tear the skin a little bit on the outside. And then, after that, then I would say if the baby's a little bit older and we're not really having blood in the poop anymore, maybe we have a little bit of mucus in the stool. And that is worth some conversation. Again, it comes down to growth and if it's repeated or just a one-off. When babies get sick, sometimes they can actually get mucus from their cold and all of that kind of stuff, and it will be swallowed and actually end up in their poop. So not always a red flag. And then I'll get families ask about like, okay, what about like hind milk versus fore milk? If their poop is really green, is it just because there's hind milk and do I need to be feeding them longer? Again, I would ask, how's our growth? How are we doing overall? Not just a single diaper. And then we get a little bit older and say we're about a month old. This is usually what happens at a month. And I have a family who will let me know that, oh my gosh, we are really struggling with poop. I really think that we have constipation or something. And what they'll tell me is that the baby will bear down and strain. They'll get red in the face. They'll arch their back. They'll scream. They'll kick. They'll cry. Everything's going to be so dramatic for like 10 minutes. And then all of a sudden, they poop. And it's soft. Like you were totally expecting a rock to come out of their diaper. And it is soft. Like, wait, what? And no, the answer is not giving them more laxatives or doing rectal stimulation. A lot of times you don't need to do that. If the poop is soft, then the issue is really likely not actual constipation. Our definition of constipation is really going to come down to the consistency of the bowel movement. If the baby has actual, what seem like rocks coming out in their diaper, it's worth a phone call to talk through your doctor and kind of make sure that they're getting enough support. And again, we're looking back at growth. And we will also want to think about what kind of milk they're getting and navigate that with you. So little babies, by and large, shouldn't have true constipation where they're having like rabbit pellets, like that shouldn't be happening. If it is, it definitely warrants a conversation. Okay, so I want to go back to this like weird straining behavior. And it's kind of a phenomenon that we see often at about a month of age, and it's called Dyschezia. I know, funky name. Dyschezia is basically pelvic floor dysfunction. So consider that the baby, since they haven't had to actually practice creating a bowel movement in the womb, that's something that is a skill. Likewise, they haven't had to actually like coordinate their arm movement intentionally or even focus their vision. Like all of their muscles are there, but they haven't really been functioning in and working in the same way. They have to really develop that muscle tone after they've been born. And so the pelvic floor is really pretty impressive. It's a bunch of muscles that take a lot of coordination and they're generating pressure by doing that. So they're bearing down on their esophagus. They're letting their stomach get really rock hard and they're trying to create pressure to generate a bowel movement. This is actually development. We want to see them hold their head up. We want to see them roll over to their side. We want to see them start to get their butt up in the air and do that swimming motion. And guess what? Pelvic floor coordination is actually part of that development too. And it characteristically is going to happen about a month. And if you're super lucky and your baby just seamlessly does this without even noticing, then super cool. That's awesome. Celebrate it. But if your baby is actually having to visibly show you that they're learning to use their pelvic floor, that's okay. And you don't necessarily need to do that for them. I like to teach families. I think a lot of families know about bicycles, and that's totally fine to do. And if that works, cool. But what I like to do is hold the baby with, their legs sort of in a bicycle motion, sort of compressed up to their belly. But I like to hold them with their back on my chest. Like we're both, walking around facing outward, looking at something, and I'm kind of pulling their knees up into their belly, giving them a nice big hug and snuggling them and rocking side to side because gravity will help to push that gas out or that poop out along with some of that compression. You are literally raising their legs up in a baby form of squatty potty. Okay. And so, that is really helpful. By the way, if you're postpartum, you should have a squatty potty, okay? It really does help reduce some of the pressure that you need to generate. I know it sounds gross, but try to picture if you're like ever trying to like poop and you're flat on your back, like it takes a whole lot of pressure to do. It's not easy. And so you're just helping them out mechanically. And then as they get older, they figure it out. They poop without much trouble and they kind of move on and it's not a big deal. Dyschezia is pretty common. We see it in a lot of babies and they just get over it. So the good news here is that as a parent, no, you're not missing something major that you need to be fixing. It's more about understanding that developmentally that's normal and they actually do figure it out and you don't really have to do anything to help them with it. Again, except if there's blood in the poop that we need to talk about, if they truly have constipation that are hard stools that we need to talk about, if they're not growing weight, we need to talk about that. But the rest, poop happens. Then I often get questions from families about what about different colored poop, especially like the pale poop. I get questions all the time about the poop is like, it's like white or it's like peanut butter texture. That's okay. What about being really pale? Now, pale would be acholic stools. And truly, acholic stools is associated with jaundice, where you're like yellow and you are circulating the bilirubin and it's not coming out in the poop to make it brown. We would have other signs that this was going on, like we're vomiting, we are having belly distension, or we are getting yellow, like in our eyes or our skin. That's not going to be an isolated weird poop. If it's an isolated weird poop, it's okay. So for what it's worth, the whitish poop is usually just fine. Okay. And then if you're on the other side of the spectrum and you have a breastfed baby that really doesn't poop very frequently, sometimes we need to do some support in navigating this. But really, I think the takeaway here is that growth is really our baseline metric that really helps us interpret if we need to be worried about the poop. And then there's some other parameters around that we've talked about. Interestingly, when you think about age, it's kind of cool. Like typically in the first couple of weeks of life, we're going to have a lot of poops and then it slowly decreases from like somewhere between average of 5 poops a day in a newborn to mine are always like 13, by the way, but like that to really like 2 to 3 for a 1 to 3 month old who's breastfed, and then about 1 to 2 stools a day for formula fed babies in those first few months of life. And then by the time you make it to 3 months, we're actually even less than that, about like 1 every other day or even like every day, just once a day is pretty common for a lot of 3-month-olds. And then by the time you get to feeding solids, that's going to change pretty dramatically depending on what's going on in the diet. And that's okay. So it's just pretty interesting that, you know, you're going to be seeing so much change with poop. And I like these conversations because I think that understanding the why really helps get rid of some of the fear so that when your baby grows and those patterns change, you can be aware of it, but not be afraid of it. Okay. And then here's my final couple of pro tips. Okay. My husband stayed home with our 3 kids for 13 years as a stay-at-home dad. Okay. Major way to go. This was especially during the time where it was like not cool to do this. And in this scenario, he learned some amazing pro tips that I'm going to pass on to you. If you are not aware already, you will learn that your baby is ready to size up on your diapers when poop starts shooting up their back. We used to call these poo-splosions in my house. And this is when it gets a little too tight around their waist. And all of a sudden now you have this like one little opportunity for it to come up the back. That's when you know it's time to size up. And then if you're changing diapers, please, please, please don't forget to pull the ruffles out on the side of the diaper where their thighs are. If you don't, you're giving the diaper an opportunity to leak. So you'll thank me later if you didn't already know that. Now, I just think that these conversations are good. It's okay if you're really still worried, but listen to this before you send your doctor a picture of your diaper. Okay, so if this episode was helpful and you want some more tools that help make feeding decisions feel clear and less overwhelming, head on over to my website at newstorynutrition.com or reach out to me on Dr. Liz New Story Nutrition. I'll respond. I'll talk. We'll be friends. And you can also find me on Instagram. I'm at Dr. Liz New Story Nutrition. I'm excited to encourage you along your feeding and growth journeys with your kiddo. At the end of the day, I find that when parents are confident and when they feel calm and centered, it really does help their kids tremendously. I just want to encourage you that you're probably already doing more than you know. So hope you're doing well. Enjoy, and we'll see you next week.